suffers from chronic patellofemoral pain, and in this video I will show a taping technique that I use near my knee that significantly reduces my pain. There are a few different ways of taping the knee. The most common is McConnell. This is a different technique that was shown to me by one of my physical therapists, but it does help me a lot and may also help some other people. If you want to try this taping technique or any patellofemoral taping technique, your best bet is to consult a physical therapist who is knowledgeable in patellofemoral taping techniques, just so you make sure you're doing it correctly. Before I put the tape on, I'd just like to mention that there are some different theories as to why taping and bracing reduces patellofemoral pain. The most traditional one is that taping and or bracing helps the patella to track more appropriately in the femoral groove. But there are also some other schools of thought. For example, Dr. Scott Dye, who is an orthopedic surgeon and a patellofemoral expert, says that taping and in some cases bracing not so much fixes a tracking problem, but actually unpinches irritated tissues in the joint. And by unpinching or unloading these irritated tissues or structures, pain is relieved, and in some cases it may actually promote healing. Another orthopedic surgeon that I consulted said that taping, bracing, things you put on your knee essentially changes the feel of your knee or your brain's perception of your knee, such that your brain is actually fooled into not perceiving the pain. And also there's some studies that suggest that bracing reduces stress or load on the joint, thereby reducing pain. So whatever the reason is, both taping and bracing can be very effective methods of reducing patellofemoral pain. So I'll go ahead and show you the one that I use. I usually moisturize the area first. Any skin moisturizer will do, because this seems to help the tape come off easier when I'm ready to take it off. So just roll up my pant leg here. And this tape actually goes slightly under the kneecap. So it's a little bit different. After it's on, you'll see that it kind of looks a little strange, but it does help. It goes around to the back side of the knee, so I'm putting some moisturizer back there. Okay, there's two steps to the taping process. The first step is putting down this cover roll stretch. It almost looks like gauze, but it's got a sticky backing. This one has squares on it. You can probably see 1, 2, 3, 4, 5. So I count out 5 squares and cut a piece off. 1, 2, 3, 4, 5. This product protects your skin from the stronger tape that you're going to put on over the top of it. So I just peel off the strips here. And this tape goes right about here. It's a few inches below your actual kneecap on the side of your calf area, and then it kind of slants up a little bit and goes around the back part of your knee. I'll stand up so you can see that a little bit better. And in fact, it's actually already on this leg. It's been on there for a day or two. The nice thing about the tape is you don't have to take it on and off every day, and you can wear it in the shower even, and it doesn't change position or come off, which is pretty amazing. Makes it pretty convenient. Okay, the second step is this Leukotape P. It's also called rigid strapping tape. It's almost like duct tape. It's just strong. So I take one of the strips that I took off of the cover roll stretch and measure out a piece of this tape that's not quite as long as this white strip that I put on. So it's probably about half an inch shorter. And cut a piece of that off. Then I put this close to the edge of the white tape. And then I'm going to stand up. And I turn my foot in like this and my leg out like that. So this part of your leg is kind of angled that way, and your thigh is kind of angled in the opposite direction. You want to get a little wrinkling. You're going to try to get a little wrinkling in this white part right here by pulling the tape, like so. You can kind of see some wrinkles in there, and then you just pull it around to the back and stick it down in the back. I'll show you the back view. There it is. And voila, you're done. And then, if you're a woman, you can put on a cute pair of cropped pants, and nobody's the wiser. If you're a guy, you can put on some pants. If you're a woman, you can put on a long skirt. I have quite a large number of cropped pants, as you might imagine, for the summertime. In the winter, it matters less with pants and jeans and things that you're probably wearing. Nobody needs to know that you have tape on your knee. I can keep this tape on for 3 days without taking it off. As I said, it goes in the shower, and you can even go swimming with it on. To take it off, you peel it off like a Band-Aid, but very slowly, or it can create some skin irritation. If you find that it's sticking to your skin a lot and it's hard to get off, mine usually isn't, but you can get these adhesive tape remover wipes. Just comes in a little package, and looks like this. It's got kind of a lubricating substance on it, and you can kind of soak the edges of the tape with that and peel it off that way. It comes with instructions. So I don't usually have to use those, but some people might need that. That's the end of this part of the video series, Taping and Bracing. And in the next one, I will show some bracing products that I've used in the